June 2022, that's the deadline grand jurors have given the Sacramento County Board of Supervisors to appoint an independent panel to conduct a new audit of federal COVID-19 relief fund usage. Those jurors have already found that the board, quote, abandoned responsibility for COVID spending with millions allocated in ways not directly related to pandemic concerns in the area, like $104 million for Sheriff's Department salaries. Government watchdog group The Social Justice Politicor is among those pressing for the board to use relief dollars still available for homeless services. We're joined now by some of the folks with some of the other groups. Mason Taylor with California COVID Justice Initiative. He joins me along with Nikki Jones from the Sacramento Homeless Organizing Committee. Good morning to you both.
Morning. Good morning.
Alrighty, so why line up advocates to call into yesterday's Board of Supervisors meeting to talk about this issue, which was an off-agenda comment item? Mason?
I know that Nikki can speak more to this due to her direct experience with the homeless community here in Sacramento. But as soon as March 15th, hundreds of vulnerable adults will be forced back onto the streets by the Project Roomkey hotel closures. These folks are older and have pre-existing conditions, the reason that they were triaged for this placement in the first place.
And then Nikki, given your work on the homeless issue, of course we were going to get to you on that, what problem do you see with the county's plans for Project Roomkey? And just Mason kind of described it a little bit, but just to remind everybody, it's a program the governor started during the pandemic to house the homeless in empty motel and hotel space. Now it's transitioned into something more permanent, Project Homekey for some people. And your group and others are pushing for 25 million COVID relief dollars to be spent on it at this stage.
Yeah, well, I would say that for the residents of the Project Roomkey program right now, that's our main concern. I mean, with this closure that they announced on February 9th, the 15th is next Tuesday. They don't know where they're going. There's a real fear in folks' experience right now. And that's a fear that the county, by not choosing a more permanent pathway, like, for example, Project Homekey, transitioning them all to Project Homekey, for example, or getting folks onto permanent pathways to housing, they wouldn't be experiencing that fear if that was what the county had carried out. But unfortunately, it's not. And these people are looking at returning to the streets, to encampments, to the rivers, and that's really scary for families and individuals that, like Mason said, are older. 51% are over 55, 39% have a chronic illness, and so this is a issue that we have to look at with longer term strategies. And the board last year did agree and instructed the staff to make sure that folks had permanent places to go before we close this program. But still, it was brought back here on February 9th with a plan to close without a plan for housing. And that's really the problem.
Another ask that you and your fellow advocates had for the county Tuesday was that moving forward with this money, with this issue, they use equity metrics to make data-based decisions. Break that down for us. What does that really mean? What are the metrics?
Exactly. Thank you for that question. The reality is that if the county were making equitable, data-informed decisions about these funds, we wouldn't be here now asking for the money that was specifically earmarked by the federal government to provide aid and long-term solutions to those most impacted by the pandemic. In this recent letter that we provided to the Board of Supervisors on Tuesday, we provided two examples right off the bat that the board and county staff could use to make data-informed decisions based on equity now. And that is the statewide COVID Vulnerability and Recovery Index and the California Healthy Places Index, both of which provide zip code level data on health, economic, and social factors that contribute to well-being.
Okay, your public comments weren't addressed in session yesterday, but two supervisors have agreed to meet with you all about your desire for this money to be spent on the homeless, right, Mason?
Exactly, that's true.
And that's Natali and?
Serna.
Alrighty, and how soon are those meetings happening?
I believe they'll be happening on Thursday and Friday of this week.
All right, so some hope that this is going to get looked at.
There is some hope, yes.
I asked go ahead, Nikki.
Well, I would just say that there's a lot of hope. The community is hopeful that the Board of Supervisors is going to choose to do the right thing.
I asked each supervisor for comment about the concerns that you raised yesterday. I've only heard this from Supervisor Frost, quote, while Project Roomkey has been a success, it's not sustainable in the long term, given the funding source we have is one-time money. The county needs to pivot into homeless programs that are both cost-effective and focus on the root cause of homelessness, such as mental health and drug and alcohol treatment. What's your reaction to hearing that comment from Supervisor Frost? Nikki?
Sure. I appreciate that we can both chew gum and walk, that we have to be not causing harm and homelessness while we're working on those, pivoting to those longer term strategies. And I would say the county has had many years and many millions of dollars from the state to be working on those strategies. And part of what we'd like to see is that comprehensive plan, is that pipeline at work in a way that's not a bottleneck. And we do advocate for that as well. But we just can't be causing this type of very serious harm in the meantime. It breaks trust with community members, and it shows a particular, I would say, service resistance from the county to really engage with the people who are already engaged in its program.
And Mason, just quickly before we run out of time, your reaction to what Supervisor Frost had to say?
Yeah, thank you. I'd also like to add that this again points to me to the need to make data-informed decisions, because Supervisor Frost has unfortunately misunderstood the root causes of homelessness. The root causes of homelessness are not drug addiction and mental health, though they are symptoms, but the root causes are economic distress and a lack of available housing units. Per HUD guidelines, we currently lack 63,000 units of affordable housing in Sacramento, and nothing in the initial ARPA plan aims to actually break ground to build new housing, and that's the problem.
Alrighty, thank you so much for your insight this morning, and we will check back in with you after your meetings this upcoming Thursday about this issue. We appreciate you.
Thank you.
Thank you.